Hi, I'm Dr. Stan Steindl, and welcome to Compassion in a T-shirt, where we explore the science and practice of compassion and how it can transform the way we relate to ourselves, others, and the world around us. Today, I'm really delighted to introduce our guest, Tom Midgley. Tom is a CBT and compassion-focused psychotherapist, a highly specialised eating disorders dietitian, and the founding director of the Body Image Treatment Clinic in London. With a background that bridges psychological and dietetic expertise, Tom brings a unique whole-person approach to helping people heal their relationships with their bodies and themselves. At the heart of his work is a deep understanding of how our minds can impact our bodies and how our bodies, especially through illness, injury, appearance, or identity, can profoundly affect our minds. Tom and his team work compassionately and collaboratively with people experiencing eating disorders, body dysmorphia, gender transition, intimacy issues, low self-worth, trauma, anxiety, depression, and much more. His passion lies in helping people move beyond shame and self-criticism to develop a stronger, more secure sense of who they are and how they relate to themselves. As Tom powerfully puts it, I set up the Body Image Treatment Clinic to help people overcome the impact of their adverse experiences as well as their own inner demons to build confidence and feel empowered from the inside out. Get ready for a deeply compassionate conversation about body image, confidence, and reclaiming your sense of self. And so I bring you Tom Midgley. Cool. All right. Well, Tom Midgley, welcome to Compassion in a T-shirt.
Thank you for having me.
It's excellent to get a chance to chat. You've got this unique blend, really, of expertise as a CBT and compassion-focused psychotherapist, but also specialist eating disorders dietitian. You were just mentioning before we started recording being in and around CFT from some of the early days. But I suppose I was curious to begin with, just you founded the Body Image Treatment Clinic, and that offers a pretty comprehensive program to your clientele. But I suppose, yeah, what motivated you to found the clinic, and was there a particular pivotal moment or an aha moment where you felt that was the work you were keen to do?
Yeah, to start with, I got into eating disorders first, and I fell into that around 2005. I was doing a locum post, and I was given the option of doing healthcare of the elderly or eating disorders. And
Right.
I was there before the other locum, and I was like, yeah, I'll take eating disorders because I've been working on a gastro ward, and it was quite sad actually helping. There was a couple of clients there who were basically sent there at the end, in a sense. They were on they were on being tube fed in directly into their stomach, and they were basically being given up on. And I found that quite strange because they were younger than me, and I remember working with them and getting along with them and actually changing. I don't think I had an affinity. I found a bit of an affinity with eating disorders. That's why I really got into it. That I found
Mm.
people who had a lot of similar lived experience to me and got it from the beginning and understood it, which I think a lot of people struggle to do. And yeah, and I fell into that and had a bit of a knack for helping, particularly people with anorexia, gain weight. And the interesting thing crossover was that was when I'd done psychology and nutrition and dietetics. And then so I was applying dietetics, which didn't really work. I tried to begin with, but I combined it with MI. I had the
Mm.
Miller and Rolnick book that was sat on the
Gotcha.
desk at the beginning. I was like, what's that about? And basically I did dietetics with MI, which ended up, yeah, being quite effective. So it was,
Mm.
and so that was me starting within eating disorders. And then the service luckily then agreed to do additional training for me in psychotherapy or behavioral and cognitive psychotherapy. That's where that element started. And while working for the NHS, I got asked if I'd also start working in a specialist inpatient unit that at the time were taking the most challenging cases in the UK for personality disorder and eating disorders. They specialised in taking the clients that would be felt unmanageable in the NHS inpatient units. I started working there and as well. And yeah, and that kind of took me on a course that got me into use CFT. And then from there, one thing all the clients in the unit were asking for was body image work. But the interesting element was that they'd all had years or decades of body image work, but none of it was effective. And that
Mm.
started bringing a different approach. And over the years there, I think I was there 13 years at this unit. I then helped developed researching the body image, looked at all the evidence base and the treatments that worked or supposedly worked, which were all exposure based and horrific for the clients. And just adapted and adjusted those. And as I did brought more CFT, I then actually tried to, this was back then about 8, 9, shift the whole unit to a whole CFT approach and started working with David Veal, who was doing it at the Bethlehem, and started trialed that. And we had some positive outcomes, but we had some challenges too. And when management changed and stopped supporting the transition, we adjusted back to a mini version of it on the unit. But yeah, the body image stuff came out of that really. We had a lot of the clients obviously downstairs who predominantly had anorexia mixed with, it was normally anorexia. There were a lot of high risk behaviors, a lot of them presented with psychotic features. So it was some really interesting clients and a huge amount of trauma that we were working with as well. But they all had body image issues, and the unit upstairs did as well. A lot classic within anorexia, just focused on that kind of whole body stuff. But because of a lot of the trauma, both sexual and physical, there was a lot of body image stuff related to that too. And that's the bit, that whole combination, just how do you help people with that element that always seemed to be the bit that was tacked on the end. It wasn't really done effectively. I was got into helping people with that and refining it over the years, and then thought I'll just carry on doing that. So I set up the company, made a bit of a comical error in the end, but which is the name, which might not cross people's mind, but people with body image issues don't think they've got body image issues. So the title of the company isn't that effective in that sense, because they normally present with anxiety, depression, or they feel they need cosmetic surgery. So it's a lot of people don't particularly probably look at themselves with that issue. They tend to maybe go somewhere else and get told they have that issue, and then maybe go through different directions. But that aside, yeah, that's how I got into it, and I've slowly been building since.
It sounds like you were really struck, and probably at a very early career time, just with the suffering that converges on these people. Comes from all sorts of angles, really, doesn't it? And whether it be sort of the trauma or the shame and the body image issues layer on top of all of that, or emerge out of it, or something. But yeah, there's just so many different sources there of profound suffering, and the people that you worked with right from the outset were really in a very risky place. It sounds in some ways it was the place of last resort or something, was the sense that I really got from you. It spurred you on. You became very focused on this from these two perspectives, the mind and the body, in a way. Just by the way, some of the best MI people I know are dietitians, so I'm not sure what that phenomenon is about. Like you obviously got into the MI and then into the CFT and so on. Just before I go on though, can you just give us a bit more of a sense when you say body image issues or that sort of thing, like what are you really thinking about there, or how would you define that piece of it?
I actually originally saw it from a much broader perspective than I guess most others. It was really working with the body and the mind. And I guess it's something we may touch on really, but what struck me, what drew me towards CFT in the beginning was somebody even now asked me to really break it down to the clients that I work with. Because even now, in terms of the company, a lot of what I specialize in, people send me the kind of complex cases, even as an outpatient, just because that's the area I've just worked in and so on. And if somebody had to really break off how do you describe what you're dealing with, these really complex presentations? And at the core, it's about fusing of emotions. It's individuals who are unable to process and connect with sadness without shame, or anger without shame and fear. And really at its core, that's how you'll do a very simple formulation, ultra simple. And from there, but it's, unless that element shifts, then it doesn't matter what symptoms they have. The symptoms are all a connectional presentation of that. So I've been really interested in that kind of body mind, especially as I started more CBT, where you're really looking more at cognitions and behaviors. You are looking at body in the sense of experiments and doing things. But there's with more manual CBT, I guess the emotional side is a would be a kind of a small e compared to the other two. And I think what CFT helped me bridge that gap and deal with that, the emotional side, which is essential for the type of clients I tend to work with. So there's a lot of working with the body and experientially and connecting with the body is essential to help a lot of the clients I work with. And I work with a lot of clients who are neurodivergent. And again, something I have a very good understanding of, having a pick a mix of elements myself. And again, particularly with ASD and struggling with introspection, the clients aren't going to do well in therapy unless you start tackling that kind of disconnect some of the clients have between their bodies and their mind. And so all of that, a
Yes.
significant part of the work we tend to do and crosses over with any of the conditions that we work with.
Yes, the body image issues, it's a disconnect between the person and their sense of themselves and their body, or perhaps it's like the body is a stranger or even an adversity or enemy or something like that. I'm sure there's a spectrum there, but the body image issues really give this sense that some sort of disconnect, and we're trying to perhaps integrate some of that. And CFT is really powerful in that disentangling things in order to then reintegrate them. You've said that the minds shape our body image and our bodies shape our minds and mental health. It's a bi-directional thing. Can you just expand a little bit on perhaps this interplay between body and mind in the work you do?
I mean, there's, I guess, lots of different elements to the work we'll do. Depending on the client, first look at how they relate to the body, because you're right, the link with all of the clients we work with nearly is they all have hatred for their bodies.
Right.
So that is a kind of an element to it. And so how we'll tend to work in it, I tend to start, most of our clients will tend to start with a more CBT element early on. It's something that I kind of had to develop to try and get early change with whatever symptoms they're managing. It depends on the client, but like particularly with eating disorders, outpatients. So a lot of the clients, they might be losing weight rapidly or might be high risk behaviors. And we tend to try and get some early change there, but very early on start dovetailing in some of the CFT skills and elements around that. Something I learned early on in the unit and I've applied all the way through that's slightly different from most people is that I don't do self-compassion. We don't do that. We do compassion, and we work on that all the way through. And that helps a lot with some of the fears, blocks, and resistances I found with a lot of the clients who've never experienced compassion towards themselves without it being part of some abusive elements to those clients. And what I tend to find is if you start people, no matter what presentation, most people want to give care to others in line with their values. They want to support others, for most clients, that is. And what we found is once you've got them doing that, connecting and feeling that sense of empowerment in the body, that warmth and empowerment, once you've got that going, if they're very depressed, I wouldn't start there though. If they were very depressed, I'd start on the other side with the blue system. We start looking at getting some empowerment from that side, getting some sense of purpose and activation on that side, and then start bringing in some more green as well and trying to start building that. Once we've got kind of compassion flow out going on, then start looking at compassion flow in. And that's normally the tough one with a lot of these clients, but found different ways of encouraging clients and working through that. And once someone has got that, they're already, unbeknown to themselves, giving compassion to self. So once they're already allowing and accepting it from others, that choice of acceptance is allowing compassion to self. And so that, as I don't tend to use the term self-compassion, maybe towards the very, very end, where we looked at it reflectively, actually, you have been giving compassion to yourself now for quite a while without knowing it. From the beginning, you might have brushed your teeth, or you might take care of yourself in some ways, and now you're allowing this. Usually, with the more challenging clients, you've had, as I said, or in their mind, almost no compassion at any time that they've either, by building it from that perspective, we can then get to a point of self-compassion as opposed to naming it, which just seems for a lot of clients to put up a lot of brick walls that might be very challenging to get around. I'm not sure I've answered your question, Stan. Obviously,
Yeah,
going to
no, I
talk
think
about kind of linking it
I,
back into the body.
I think that's good. I guess my question was this kind of mind shaping our body image and our body shaping our minds and our mental health, and that sort of interplay, both bi-directional sort of interplay between the two. And yes, it's interesting because I suppose you've really made the point that that self-hating, self-loathing, shame is often at the heart of this by the sounds of it. And what you're trying to do is really just proceed gently, proceed slowly, not race to things like self-compassion because you bang up against the self-hate. And so, and yet often these people might feel much more compassionate towards others and might hold others to a very different kind of standard or judgment, and in fact be much more compassionate really towards others. And so you start there, and it really is, yeah, just taking advantage of those elements of the mind that's already there, perhaps already active, and using that to just slowly but surely move towards the self. It's almost slightly by stealth in a way, where they get to a point down the track where you're able to reflect with them, hey, this kind of is self-compassion in a way. And perhaps it's once it's there and it's felt and it's less resisted, I suppose.
It is, and there's a lot of discussions within the body image kind of community all about different approaches, whether it's like about body neutrality or kind of body positivity. And actually, I think I kind of reading in a lot of clients have issues with the different terms and what they mean, and also some of the communities actually, and some of the stuff that happens within those. I know that when I've kind of asked clients to go and explore that and see if they relate to it, I've come back with some unpleasant stories about again, yeah, I guess where people clearly got an agenda to what their to their body image and what they want, which appears. But I think taking that compassion element, it's not for me to then choose which direction the client goes. Once they've developed compassion themselves and start to be able to change that relationship with their body, it's for them to decide with in relation to their values how they want to live with their body, how they would want their children, if they have children, or their friends, and they can relate it to their values and slowly adjust their relationship to body in that direction, and then work with what their sense, what they want to achieve, and I find that again much more helpful than getting stuck in within specific, I guess, names or what that then brings.
Well, sort of ideologies in a way, isn't it? I don't know if that's quite the right word, but I have
It is a bit.
I have noticed too, yeah, that there are these different approaches as much as anything where people can have a fairly clear sense of what they feel is the best way forward. And I think what you're saying is that you're really wanting to tap into the intuitive wisdom of whoever it is you're working with right now, that given the space and the safeness and this kind of just cultivation of a compassionate mindset, that's the fertile ground where they arrive really at what the relationship with their body that they really would like to have. And we're trying to move away from a more adversarial relationship and so on. But what the relationship becomes is there's a range of options there maybe that they might decide amongst.
Yeah. I have to be honest, most of them end up with body positivity anyway. I think the
Okay.
idea of body neutrality is almost that, but most clients at the beginning, the idea of body positivity is so far, it's not even comprehensible what that could be like. But actually bringing that a compassionate approach tends more often than not, that's where we get to, is individuals actually developing a much more positive relationship with it. What's really interesting with a lot of the clients and across the age group as well is what you clearly see within body image. So how I tend to talk about it, I've got two kids, and what was really interesting to me was even before they could talk, my son, in terms of clearly aligned himself with a male gender, in the sense and how you could tell was if he was around a group of older boys, you could see his eyes light up and he'd get all excited. If he was around a group of older girls, not really interested. He'd be role modeling off bigger boys and aligning with that. And my daughter followed the same trend. I know not everyone does, but you could see you could see the modeling of bigger kids happening from that early age, and those bigger kids modeling off other bigger kids, and so on and so forth. And when that relates to body image, you can you start seeing that behaviorally and all the way through. And what I tend to find is that we've got so much influence of pushing on body image across the lifespan. So it doesn't even matter if your kids aren't watching TV. They're modeling off kids that are watching TV and involved in media and social media. So it goes all the way through that. So when you work with some of the young adolescents, they are much more challenging to work with in the sense because you talk to them and they are clear-minded in the sense that if I look like all the people I'm following on Instagram, I will have the best life ever. Everyone will love me and I'll be rich and it gives me everything I've ever needed and wanted. And there's no counter argument to that. When you work with somebody in their 20s, what you tend to find is, particularly females who will turn up and say, most of the time I'm a staunch feminist and I follow that and I preach and practice it and I hate myself in terms of how I relate to my body because I have these two complete Daleks that where I'll get dressed to go out and I'll be competing, I'll be comparing, I'll be objectifying all my other female friends and everyone around me, and I can't manage that. So within that, you're trying to help people because it can't be one or other. There has to be a middle ground. You can't turn your back on what's aspirational within our culture. As I say, even if you joined a monastery, and there'd still be an element of comparing and pruning, and because it's part of who we are and our nature within that sense. So it is helping people find that blend between their values and what they've been taught to be for 15, 16, and all that huge influence on body image. It is that element we've been taught to see the world in one way, and then slowly we can see it in another. But it's quite schema based. It's kind of one or other. Finding that middle ground is quite challenging because it's not a fixed place. It's so different parts of our mind are pulling us and pushing us in different directions, and you're trying to help people get to that point. And with younger people, you're trying to help them understand a potential other way, which isn't always easy.
Yeah, there's just this massive influence from people and peers and society and all the rest of it. And it's really, we have these tricky brains, as we all keep saying, and we were evolved to do that, to understand ourselves in the wider group and to compare ourselves with others and to have that somewhat competitive part of ourselves or that social rank part of ourselves. But it really is the source of so much suffering because we end up in this kind of body perfect place where there's this ideal version of what we really should be. And when we're not, then we're in a body shame place, which sort of flings us back in the other direction. And sometimes people are kind of like, but I'm a feminist, or but I'm whatever. Like I've got all these other values that seem like they just don't fit with this body perfect, body shame. And yet there it is, because it's hardwired in there in the brain sort of thing. And somewhere in the middle is body neutrality or body positivity, but it's hard to get to that sweet spot when we swing from a kind of, I don't know, yeah, perfection and shame, or pride and shame, or something. These tricky self-conscious emotions at either end.
It is, yeah. And it's even when you get to that middle bit, it's not clear and straightforward because it's
No.
still want to get dressed up and look good at times and feel good, but it's still always in the context of others in our culture. So we are still comparing, even if we pretend we're not, because it's that if I'm going to a
Yeah.
shop and I'm buying an item of clothing, it's because I feel it looks good on me. And if it's looking good on me, that's based on my sense of what looks good in our culture and me they're competing and comparing within that domain. And whether I pretend it's just for me and it makes me feel good, which is really isn't, it's bigger than that. So you can't escape it. You're still going to be doing it. But how do you do that in line with your values where you're harming others as little as possible, but still with that blue system stuff, but still feeling and allowing yourself to feel good as well and getting that sense of more blue system empowerment from that kind of competing, comparing, and side of things.
Yeah, not harming others or ourselves in the process, isn't it? It's difficult. We want to be able to have a bit of a focus on self and appearance and successes and achievements and feeling good in the community in which we live and so on, without it spilling into that more threat-based drive kind of situation where we are much more likely to be flailing about and knocking things over, others and ourselves, and so on. But this is a really simple question then. Maybe it's a very complex answer, but what is body positivity then?
Actually quite, it's actually quite not necessarily complex. The word itself is slightly misleading to some extent, but individuals think that you have to see your body in a positive light, and it is that to some degree, but it's broader as well. It is getting to a point where you appreciate your body more as a whole, that you can appreciate what it does physically, what it's able to do for you. It isn't just seen as an aesthetic object, but seeing it more holistically in a positive light and having that relationship with your body, as opposed to with a lot of people with body image issues, they see it as one whole hatred item that just holds them back and causes them suffering. And it's trying to change that in lots of different ways. So that relationship is more holistic and positive.
Yes, I appreciate that. It's the body image suggests that it is more focused on appearance in some ways, and body positivity is more expansive about it. There's a whole range of aspects to the body and functions and purposes and so on and so forth, and that it body positivity involves things more like appreciation or being able to affirm the qualities and strengths that we may in fact also have, or the way that it helps to get us through the day sort of thing, and being able to acknowledge some of that and bring compassion to it, and perhaps a kind of an empathy, sympathy to our own bodies and what it's trying to do for us to get us in and around the world.
There's another element to it as well, which is kind of more political in the sense, which is trying to reduce the shaming of people's bodies, so that maybe culturally we're less attacking for people's different shapes, sizes, and types of bodies. So there's that element to it too, which is, I guess, more of a, I said, more kind of political and cultural, really, just trying to change the landscape and try and reduce the idea that there's only a handful of aesthetic bodies that are desirable, and actually can be more accepting and open to the different bodies that people have. So there's that side of it as well. Again, a lot of it's about de-shaming, really, and trying to change how we treat people and change how we are.
In a funny sort of a way, the whole movement is a compassionate one, really. It is about trying to create a bit of a ripple effect to spread the word, if you like, of just changing our approach to our bodies as a society as a whole, really. And in order to reduce suffering, to alleviate and prevent suffering, really, is at the core of the body positivity movements, if you like, and that sort of thing. And we might try to bring that to the individual that we're working with right now. So I'm curious about some of canon, if you like, from CFT, of the different activities or exercises. Amongst all of that, do you find that anything in particular really resonates strongly with clients and seems to feel particularly helpful in and around this topic?
Yeah, but it's quite a funny one because it's different skills at different points. I think in the program there's 13 different CFT based skills, and they progressively become more body image focused. And it starts with kind of typical soothing rhythm breathing and grounding. But a lot of my clients, it's funny, I've never really been able to get any of my clients or many of my clients into soothing rhythm breathing. And I know a lot of them have issues with connecting with their body, and a lot of them have a lot of trauma and elements, but that the breathing one, just for a lot of the clients, just occasionally get somebody who just loves it, but more often than not, it's not the one they go for. The one after that I tend to do is I'll bring in color imagery, but with that color imagery, we'll also make it more tactile. So look at it more as the color imagery is more of a soothing object that's so it tends to get them to do it while putting on a duvet, using a kind of a duvet or a big jumper, or try it in water. So just trying to bring in that extra, or a client who has never been able to calm herself down and managed to use that with an electric blanket. She's a quite underweight client, and that with an electric blanket. She was suddenly, you came back the next day, she was like, oh my God, I was able to actually connect and slow down. Trying to find where else. Some people it's sunshine. You have to be, can't always use that one in this country. It's only a few days a year in the UK, but a bit of sunshine there, they might be able to use that as well as it. So that one tends to work quite well for a lot of clients, that they're able to find objects almost to soothe. That actually reminds me when I first set up the CFT group with on that inpatient unit, I ended up trying to find objects that they'd be able to use to soothe and feel soothing from, that weren't going to relate to human trauma, and ended up going into town to charity shops and buying 15 different stuffed toys. So we had seals, teddy bears, all these different animals, unicorns, and someone could go and select the toy they were going to give compassion to this week, and eventually compassion from. But yeah, just they're obviously that next step closer to it being having a mind and a brain, but initially just trying to look at how you can get soothing from that color imagery and objects from there, and then trying to shift into compassion flow out, compassion flow in, and then so those ones, people tend to, that compassion flow in one's very challenging for a lot of clients and takes a lot of working. The one after that is actually start to do work on confronting a critic. And that tends to be quite interesting, but if they've done enough of the effectively work to date, then that can be challenging, but they tend to get on top of that quite quickly. But from there, one of the main elements with a lot of my clients is assertiveness. A lot of them struggle. There's a kind of a vacuum in the middle of their capacity for assertiveness. They can tend to do assertiveness at the bottom end. That middle section tends to be fused with shame for a lot, particularly my female clients. We have a culture where girls are disencouraged, let's say, to be assertive, where they get called bossy or told to be good, patient little girls. And you have a lot of shame in that midsection. And then some of them lose their temper, the non-swearing version of what I was going to say. So you've got that early zone nothing, and then lose it, because same for all of us. A lot of us have a void somewhere in that assertiveness continuum, if you imagine it, or ability. We have to do a lot of work to be able to feel and generate that strength from compassion and other elements, and practice a lot of assertiveness so that they can start confronting that critic and start working with the critic. And then once they're able to do more stern assertiveness, to say, then start to kind of shift it more to playful and compassion. How do you start bringing compassion to your critic, start working and understand where it comes from, and bring compassion to that suffering that typically generated the critic, and what it then represents. Trying to remember all the different steps where I tend to go from there.
I was just going to check in with you, yeah, because I had wondered that about the body-based practices. There's the breathing, but also body posture, facial expression, and then there's sort of movement, and then acting or embodiment strategies, sometimes in CFT, so on. And I was curious about whether they were received differently for people, if body image concerns are really at the forefront, but you mentioned that soothing rhythm breathing doesn't seem to have the same kind of effectiveness, but it sounds like you're persisting with that as the first kind of entry. So yeah, what do you think happens there with some of the more body-based practices for people?
The ones I tend to do, they become more body-based later on. And some of the actual steps that I tend to put in between is kind of shift into more mindfulness-based stuff that's got a compassionate, which is with a big compassionate element, which I call mental block. Acknowledge and disengage, where we actually start getting into a body scan not long after that. And it's a different approach. We look at two main approaches with our critic or our mind's different parts. Start with the compassion to begin with, which is actually the engaging with it. But actually, in order to engage with it effectively, you've got to be able to feel empowered. And most of the time, these clients don't feel empowered and able to. So they also need to be able to acknowledge and disengage. So by doing a body scan, and actually you're working through that. And then when the critic turns up or other parts of the mind, they're able to acknowledge it and then say, leave, I'll come back to you later, or make a time. So learning both acknowledge and disengage, and kind of engage and confront or connect. So actually learning that ability when they feel able to and empowered to work with these parts, but when not able to acknowledge and disengage and make an appointment later on. So trying to work on that, where you're actually then starting to bring compassion to the body by noticing more kind of physiological symptoms of kind of stress or tension or pain, working with a kind of more compassionate slight edge to that in sections, but in a way that's then dealing with those kind of intrusions. And later on, we actually do the more challenging stuff, which relates to body image, which is the exposure stuff, which is mirror based. But by then, we've done so much work with their compassionate other and their kind of compassionate team that when they start using mirror work, they can do both the acknowledge and disengage or engage and work with their parts or not. And then once they've done the mirror stuff, then it's about moving. So then, and they're then able to try and move. There's exercise around moving around, and then we shift on to, once we've managed all kind of internal conflict, it's then external conflict, helping people manage where they're being criticized or attacked externally, and actually shifting some of the exercises into that, so that people are able to deal with kind of those external challenges once they've tackled a lot of the internal ones. And that tends to be the main process when.
There's there's like a systematic desensitization, to use the old term, almost running through it, isn't there, in a way? Initially, it's about just acclimatizing to the process itself and developing that kind of safeness to begin with, and just gently moving in with some of the more basics. And then it's a bit of a kind of exposure to compassion even, and beginning with compassion for others, but then gradually exposing people to receiving compassion, and then perhaps even self-compassion. And there's certain body-based practices there, but also imagery, by the sounds of it, come into it. But then you get to a point where actually there is more, even using the mirror, I guess, to do a kind of more specific exposure-based thing, but also compassion in the mirror is a nice thing that we often get to, and then starting to help people to be assertive with themselves and then assertive with others, and the more relational stuff goes from there. So there's this kind of building, this gentle building flow towards some of the more kind of, just more difficult and scary kind of processes that happen towards the end.
Definitely. It takes me back to the very beginning. So when we started doing, back in around 2006-07, where I started doing a lot of the body image work with the clients, say in the inpatient unit, and the evidence base there, and it still is today, it's mirror exposure. But a lot of the research showed that the less someone is doing with their mind, the better the outcome. So they compared it. They didn't do compassion specifically, but they've tried it with mindfulness, kind of DBT skills, etc. And I think the trials that were there at the time, and I think they still are, have shown that the most effective is you get someone to stand in front of a mirror for 25 minutes and just look at their body. With the clients I was working with the trauma histories and their body image stuff, it was, and even you do that, and wow, we'd start with the final version was, we'd start with, in essence, a whole cohort of maybe 20, 30 clients. And then we take them through different steps, and they'd wean down at what step they were ready to do. And they kept redoing it. And then you'd end up with 4 or 5 who would then felt able and ready to do the exposure stuff. But it just felt so cruel. And you spoke to them, and it's like, this is supposed to work. And for some of them it worked, and for some of them it was just, but even the ones that worked, it was just traumatizing. And it was just like, this is flooding right at the top end, and there's got to be a better way. And it was at the same time that I started, it was just before that I started getting into compassion and fell into it. I found something that I was looking for at the time, which, at the time I was doing CBT outpatients and I was doing the inpatient stuff. And we had great outcomes, but the bit that was interesting me was the ones that weren't getting better. And they were the ones that I was interested in. And at the time I was training, doing CBT masters with, and one of the guys on the course was a guy called Chris Irons. We were in the pub afterwards and just talking after our groups, and we were chatting, and I kept telling him about these particular clients that I was struggling with. And on the inpatient unit, when I first went and started doing therapy there, it was going from a CBT perspective, needing to find kind of joint goals and asking, I'm your new therapist, what do you want to work on? And them saying, I don't want to work on anything, I just want to die. How are you going to help me die? I don't deserve anything else. And it was kind of like, oh, so we've got no shared goals? Oh, I'm a bit stumped, actually, then, and try to work with that, and try to work from a CBT perspective, trying to test the theories that they were the worst person in the world, and not getting quite far cognitively, but it not changing anything from an affect perspective. They could understand they weren't the worst in the world, but heart, head, lag, it didn't make the blindest bit of difference to them hating and despising themselves and wanting to die. And then, having a chat with Chris that time, and him telling me, I'm interested in this particular mode of psychology that might interest you. And it was kind of like, wow, this is a missing link. Because with the outpatients, I remember one at the time was trying to do thought records, and this guy coming back each time, it was like, I've done that. Even my thoughts are the worst ever. My thoughts even let me down. And then this guy then disengaging because he couldn't do the thought records because they're so shameful that even his thoughts were unhelpful and useless. And that was just one at the time that was, so when I actually started talking about this other way of working, and it just resonated, not just with my clients, with myself as well, because I'm someone that definitely didn't have a lot of green system growing up. And so it resonated across both sides. And suddenly with that change of perspective, especially on the inpatient unit, we had some phenomenal outcomes. And part of the reason from what you said before, that this was a group of clients who they've been written off. And at the time, CFT didn't have much of a name, and you couldn't evidence-based practice. So it was subtly bringing in CFT and saying, we're doing CBT informed a little bit by CFT. If you felt you were being naughty and bringing in these elements. On the unit, it was, these clients are written off, nothing's worked for them. You can do what you want, really, as long as. So we started that approach, and the clients and we had some phenomenal outcomes. We were running groups and trying to bring the whole unit, but it was the ones who had the groups and the individual that really had some phenomenal results. People that have been in hospital for 10, 20, 30 years, never spending more than a few months out, getting out and starting a life and starting again. So it really was transformative. Some of those is a different approach. And
yeah, you mentioned a lot of good stuff there. The sort of almost brutality of some of the exposure-based approaches, isn't it? Like it can feel as effective as it can be in various conditions and so on. It can feel harsh. And so you were chatting to Chris and so on and bringing the tone piece is so important, isn't it? The sort of the warmth and friendliness and care and compassionate tone in the self-to-self relating. Is that some of those self-hating, self-critical thoughts are just awful. When in fact, it's a real privilege sometime in a funny sort of a way when clients really do disclose just how harsh and attacking and condemning their thoughts can really be, because often they might hold that a bit close to their chest, but the actual self-to-self relating is so vicious. And how do you get there, do you think, that shift from self-criticism to self-compassion with your clients? What are the sorts of things that they might end up saying, I guess, after a course of treatment like this to themselves in a more self-compassionate way about their body and their body image?
I haven't measured it exactly. I do get them usually to separate the minds into different parts. I don't know, in the program, something I developed ages ago, I got heavily into compassion, and then I kind of stepped away and went on a different journey of self-exploration, really. And part of the reason was it was working so well in outpatients, but when I tried to apply it with the cases I had as inpatients, but when I tried to apply it in my outpatient setting, and actually the truth is my outcome measures bombed. Is the truth of it, and it was, and that's because I dropped the CBT and went CFT straight out. And I think that period at the beginning where we weren't getting that early change with some of the symptoms, I said a lot of the clients I had were presenting with quite strong symptoms. So yeah, you couldn't ignore them. You had to help them with the kind of the harming behaviors or the weight loss or the extreme purging, and you couldn't or extreme laxatives. You couldn't really ignore that. And by trying to develop that compassion side first, and at the time asking around for support, it didn't seem a lot of focus on individual within that, or what the advice I was given wasn't quite working. So I went off on my own to try and overcome that, and explored kind of schema therapy and went down that route, and always bringing in the CFT, but just trying to do things in slightly different ways. And I guess, where am I going with this? With the critic side of it, what I do now, that's what I was going, multiple minds. So in doing that, I also adjusted or created a slightly modified version of the 3 systems model, where, I don't know if you're going to see it, where I've kind of the blue system I've split into 2, and as well as the red system, I've kind of split that up into parts. And that's particularly helpful because a lot of the clients that I work with, again, with more complex presentations, if someone develops such strong OCD before they develop eating disorder or other features, it brings a kind of unique presentation where if you split the drive system into 2, as I said, one that's focused more on achievement based, so pride and achievement, which kind of neutralizes shame, which is a more one half of an anorexic feature of an anorexia or eating disorders. But you've also got the other half where you've You've got worrying behaviors to try and control fear and uncertainty. So you've got that side of which is blue system as well. And they have different slight roles within that. And it becomes much more clearer when working with BDD or with eating disorders where there's a lot of shame and a lot of fear, is you have these two mechanisms that work. And if you see it as one, you can kind of get lost. But if you can separate it out, what you'll see is that when you stop somebody, let's say with anorexia, losing weight or eating disorders focus on weight loss, they'll become far more obsessional. So their way of trying to manage will then they'll increase the ruminations and that side of it. And that's where in treatment, a lot of people get stuck because it's called whack-a-mole. You fix one thing and it just springs up somewhere else. And by separating them out and understanding their functions and the different emotional issues underneath, you can then target those with different strategies that then help that person overcome those hurdles. And what I was mentioning that is, back to the critic, is actually helping people develop understanding of the motives for these different parts and doing that as posters. So you start off with a lot of work and understanding that. So you get the initial, what the critic's presentation is like at the beginning with how they talk, their harsh words, its motives, and understanding that. But over time, the critic it changes within the approach. And someone was asking me the other day, does it get swallowed up by the compassionate part, or does it just become more compassionate? Because I guess different people might approach this in different ways, but the way I tend to approach it is the motives of the critic are really helpful fundamentally. They make accountability and identifying our issues, and people will notice with their critic that their critic's actually quite helpful in certain situations where it might point out things in a way that helps them stay empowered and change, and other times it might be very harsh and undermining and disempowering. And it's within that sense that we're just trying to help the critic change its language, change its approach, how it works with us on the whole, so that it helps us more empowering. So what we're trying to do is just shift how it helps us from that kind of disempowering critical shaming and shift more towards more helpful. So there is that adjustment over time, and the language adjusts over time on the whole, let's say as a percentage, but initially you can still identify usually where your critic is being helpful. And some people might call that the compassionate part, not the critic, but I guess get stuck within theory. But this way I tend to find with a lot of clients tends to work really nicely, that they just change their relationship with their critic over time and it becomes more compassionate and more helpful in the way that it functions.
Yeah, it's the forms and functions of self-criticism stuff that Chris Irons really did look into, and he has his measure, of course, and whatever, but the concept's really interesting. I like that little thought experiment. Is the compassionate self coming in and addressing the critic, or is compassion coming into the critic and how it operates, or a little bit of both, perhaps? There is maybe the compassionate part that is, speaking to or having a conversation with the critic, but the critic also shifts from that more shame-based self-criticism to something more like self-improving, constructive self-criticism or something like that. And we don't really want to throw the baby out with the bathwater. We want to be able to critique ourselves to a degree. Like when something doesn't quite go right, we want to be able to look at that and work out what to do better and that sort of thing. And yeah, it's almost two parallel processes there. There's a part that we cultivate that starts to bring wisdom and strength and courage and care and a bit of empathy and sympathy and all the rest of it to ourselves. And then the other parallel process is the critic starts to shift and move and become this more constructive part maybe as well.
I'm trying to do the same with other parts, just identifying the other parts that for a lot of us, they push and pull in different directions, and trying to get the compassionate role is almost like bringing them in and trying to get the whole team to move in a similar direction, as opposed to pushing and pulling in different ways. And the compassion that's the element, the angle to kind of pull it all together, really. So kind of work from that motive, that viewpoint, and it tends to find that's most helpful, that I found works for my clients over the years.
Your philosophy, or the philosophy of your clinic, I think, is really about empowering people to feel confident in who they are. And just a sort of a last question, I guess, if you could magically give everyone a sort of one belief about themselves that maybe would help with that, what would it be, do you think?
Pause for a second. I made a note.
Oh,
I've been
okay.
asked this before. Okay. One thing that tends to come up with, in terms of commonalities, I tend to find with working with something like their critic, in terms of the motives, it tends to either be why do we criticize ourselves? And a lot of the time it falls into kind of two categories of, one's about self-improvement and the other one is to protect from being attacked by others. And a lot of their clients with body image, there's a lot of social ranking side of things where they'll, in public spaces, they'll go in and immediately check out who the most desirable people are and negatively compared to those. And then sadly, we also look to make sure they're not the least desirable in the room. So then they're positively comparing against them. Oh, at least I don't look like them. So I mind doing that quite a lot of the time for a significant amount of the clients I tend to work with. And one of the kind of thoughts that kind of help people get their head around is the idea that the truth is, because of the way our blue system functions, you're going to be judged. That's, some people like the idea that people aren't looking at me and they're not judging me, but the truth of the matter is, a lot of the time, a percentage of people will be, and they will be judging people harshly, because that, again, is part of our blue system, that if we push people down, we can push ourselves up to feel good, but we can also push people down. And for a lot of people, that's how they function. So there's an element of the kind of thought that can help people work with and actually work with and practice in some of the exposure stuff, is that people are going to judge and hate us. A percentage of people are going to judge and hate us whatever we do. So you either live for the haters and then look at what that looks like, or you live for the lovers and the compassion. And you either actually got to make a decision, because if all you spend your time worrying about is someone's not going to like you or look at you, then it's going to be a pretty miserable existence. So I guess a shortened word is something like, do you live for the lovers or live for the haters? And take that approach. And then with bringing in compassion, that can help people in public situations. That doesn't really matter if they look at me. Somebody are, what am I here for? And this bringing your mind back to why I'm at this social event, and actually following through on values, as opposed to getting hooked up and wondering what people are going to think, or on that side of it, and just go and enjoy yourself. So there's an element there that can be quite helpful with body image, and actually in a broader scheme as well, in terms of kind of trying to manage that.
Yep. Yeah, love it. I often think to myself, if only people could not care what others think, sometimes we would be free of a lot of our suffering. But no, I love that. Like living for the lovers, living for the compassionate. That's what it's all about. When I turned 50, I must admit I had this really palpable feeling of liberation. I suddenly didn't care what people thought anymore. Maybe a little bit. But all right, Tom, thank you. Thank you for all of the work you're doing. You've had a long and successful career, really, in working in this area and applying it in your current clinic. That we'll put all the links and so on in the description below. But yeah, Tom Midgley, thank you very much for speaking with me on Compassion in a T-shirt.
Thanks for having me, Stan. It's been fun. And I've enjoyed the listening. Yeah, listening to them over the time. It's been great. I've had some fantastic guests on. It's been great learning for me as well.
Good, mate. Thank you very much.